I'm going to discuss previous work that we've done, review our current projects, and then discuss the future direction and where we're heading with this work. I am so excited today to just be able to, it's really a privilege and an honor to kind of introduce to you all and debut to us our rebranding. In passing, we call ourselves RH Impact, but our full name is Reproductive Health Impact, the Collaborative for Equity and Justice. We're just so thrilled to announce this transformation in our journey to more equitable and just world for Black communities. We announced this official response of, again, Reproductive Health Impact to the Collaborative for Equity and Justice, and retire our former name of the National Birth Equity Collaborative. With this rebranding, we're not only embracing a new name, but also a renewed sense of purpose, unity, and vision. We're more than just a name. It symbolizes our unwavering dedication to fostering equity and justice in Black people's experience. The transition to RH Impact signifies our resolve to amplify Black voices and expertise, ensuring that their needs and aspirations take center stage. Our new mission and vision is, our vision is creating a world where Black communities can achieve our full potential for reproductive health, well-being, safety, and joy. While our mission is to collaborate in collaboration with communities, RH Impact challenges systemic inequities to achieve reproductive equity and justice. We apply research and evaluation to policy, advocacy, capacity building, and power shifting strategies, while centering the lived experiences, scholarship, and activism of Black communities. And what I'm excited to show you throughout this presentation is the ways in which we do this is our work is absolutely centers Black voices, Black communities, and our organization is comprised of Black leadership, Black scholars, Black activists, and a whole entire team you'll see of staff. So just what does it stand for? What does RH Impact stand for? Well, one, in the name, breaking down that name, reproductive health. Our work is rooted in reproductive justice, racial equity, and human rights framework to improve health equity for all by prioritizing the impacts of social and structural determinants of health, as well as their root causes. RH Impact is nationally recognized for improving expertise on health equity, reproductive health, birth outcomes, public insurance, reproductive health care, including well woman, maternal and prenatal care, community-based engagement, staff development, and integration to address biases and racism among those who interact with pregnant people in outpatient, inpatient settings. And I want to highlight that our organization, that staff development key, is in engaging with this work with my colleagues, it's the difference between work and passion work. And it's a whole other level of development and protecting our time and work-life balance when you're doing passion work. One of my favorite things to do is when we have a new team member join our team is go, welcome to the team and welcome to passion work, or they go, I'm so excited to be here. And we kind of like have to help each other protect our boundaries. It's quite incredible, or else it's because it's passion work. We find ourselves are burning out in very different ways than you would any other work. The collaborative is we believe in the power of partnership and collaboration. This is why we have a unique shared leadership model. We have 6 vice presidents who I'll introduce on the next slide, who lead it together. It is absolutely identify as Asian, and my lived experience is as an Asian woman, but witnessing and being a part of what it means to work under Black leadership is so incredible, and a model that just about any organization should and must experience. It's incredible how we protect each other, and even difficult conversations where we're just, it's at the end of the day, it's about uplifting each other. It's quite incredible to watch their leadership. Equity, our core value is equity. We strive for a world where everyone has equal access to reproductive health care, education, and choice, with a very particular focus on Black communities. And then lastly, justice is the heart of our mission. We're committed to dismantling systemic barriers and promoting justice and reproductive health policies and practices. I just want to pause here. As a presenter, I promise you the rest of this is very less words in all of this, but because this is brand new, because these statements are new, I just wanted you to also see and experience this out there and just really be intentional about reading exactly what we are and who we're for. So usually not my style, but I just wanted to share this and why it's such a big deal and it's so important for us. This is our leadership. It is absolutely shared leadership. These are the incredible people who are guiding and leading and behind us and helping us navigate this space and leading us at RH Impact. And this is our research and strategy team. You can see we're small but mighty. We get a lot done. It is quite incredible, and you're going to see that when I'm about to dive into the work we do. I want you to remember, like, what all of this is done by these 6 incredible individuals, and the answer is like, yeah, we do. We show up and we do it. One of my favorite examples is we are so effective and efficient and brilliant in this work that sometimes when we're collaborating with bigger organizations, one of my favorite things is, we'll show up with like just me and Kiara, and they show up with their team of like 10, and we're just having as much of an impact. And we are tired and we're always trying to build up and get bigger, but I just want to highlight that we are small and we are mighty. So just to level set, and for the context of this presentation, I will be using the term birth equity, and it's the assurance of the condition of optimal birth for all people with a willingness to address racial and social inequities in a sustained effort. And that is by the founder of the National Birth Equity Collaborative, Dr. Joya Career-Perry. Respectful maternity care, for the context of this conversation, is creating tools and supporting infrastructure to support better birth outcomes. It's a radical shift in practice to reduce inequities in birth outcomes. And it's normalizing a new model of care at the core of medical practice. And I have to pause and say that normalization of a new model of care is one of the hardest things. As we engage with community members and stakeholders, we actually are asking, like, what is the ideal? And it's kind of that like public health kind of thought experiment where you're only swimming in polluted waters. You only know your own polluted waters. So to imagine your way out of that is really, really hard. Often as we're trying to imagine what that new model of care is, you're stuck in all you know. So it's quite fascinating asking people, community members, to dream their way out of the system and say, like, hey, y'all, it does not have to be this way. So I'm going to transition to completed RMC projects. So our first project was the Respectful Maternity Care Collaborative. It was funded by PCORI, the Patient-Centered Outcomes Research Initiative Engagement Award Program. This program supports projects that encourage active and meaningful involvement of stakeholders. It's really about patient-centered outcomes research, and it's also about moving forward to demonstrating comparative effectiveness to all different models. So the definition, so RMCC is the Respectful Maternity Care Collaborative, and the definition of that collaborative is a formalized partnership of stakeholders dedicated to improving maternal outcomes for Black birthing people through patient-centered outcome research and comparative effectiveness research. The goal of this project was a long-term buildup of a Black maternal health research agenda that is led by Black birthing individuals. And so when we through this project, we assembled an advisory board. We distributed the Future of Black Birthing Research survey. We put out a survey to Black birthing tailored to Black birthing communities and individuals Black identifying individuals with reproductive experiences. It says, what do you envision for the future of research? And that's from that survey, we analyzed the data for themes and said, like, what are some commonalities? We brought together our advisory board and stakeholders to prioritize those themes. We had so many incredible ideas and visions for what that would look like. We refined those definitions, and then this is what we came up with. The 10 priorities to eliminate Black maternal health disparities. I encourage you to go to that link. But the first one is systemic change, full spectrum perinatal care integration, culturally safe care, personal decision-making, birth worker and healthcare professional pipeline, investing in funding in Black maternal health, listening and supporting Black birthing people and their villages, availability and access to respectful and quality perinatal care, accessible and respectful education and resources, and professional development. So those are the findings of that study, and it's I invite you to dive deeper into those findings using that QR code. The second work we've done is we established and developed something called the Cycle to Respectful Care. So the Respectful Maternity Care Initiative bridges community assets to hospital care by centering cultural, biopsychosocial, and holistic needs of Black mamas in order to reduce disparities in clinical and patient-reported experience measure outcomes for all birthing people. The Cycle to Respectful.
Susan, this is Betsy. I'm sorry to interrupt. The QR code didn't work. Is there a link you can put, or can you tell us where to go on the website?
Yeah. May I get that to you? Yeah, absolutely. Thank you.
By the end?
That might have everything to do with our revamping.
The rebranding.
Yes, and our website. And so I apologize. I might not even, at this moment, I would have to do some
I can send it out in a follow-up email to everybody.
I appreciate that. Thank you. Thank you for calling that out. And I will notice change it too in these slides. Thank you for that. And then the Cycle to Respectful Care is a part of our RMC initiative. So we basically developed this theoretical framework based on birth experience of Black birthing people to inform how hospitals and health systems can achieve birth equity. The main feedback we got, especially with work and movements in the earlier in the 2020, was like, well, how do we do this? What does that look like? Can you tell us how to do it? And so in response to that, we developed this framework. So I just want to highlight that we hosted 7 focus to get feedback to inform this process. Again, patient-centered, Black birthing, patient-centered work. We gathered focus groups. Participants represented numerous communities across the U.S. and a range of socioeconomic backgrounds. And then we identified 3 different frameworks to guide the approach for participant recruitment, facilitation, engagement in this work. In these frameworks, it's so key to anchor ourselves and remind ourselves of how we engage with communities, and anchoring ourselves in frameworks that center reproductive justice, cultural humility, and research justice. So this is the product. This is the outcome. And what I will also do is email and send the paper. So each of these steps in the cycle come with very detailed how-tos for that. But essentially, the high-level view of this is, if anybody is willing or wants to engage in this process, it's that waking up, entering the cycle, getting ready, recognizing and challenging beliefs and your implicit biases. When I fully acknowledge that we all come in to this world and are influenced by implicit biases. We can't help it. If we consume any type of media, if we interact with the world, it's full of bias and centering of very specific cultures and communities. So the next stage is reaching out and implementing within the provider community, trying to see ways in which you can hold your colleagues accountable. And that's that yellow circle. And then it's going beyond your colleagues within the provider community and even coalescing and reaching out to your community, creating change, transformation institutions to create a new culture of care, and then maintaining. At that core, right in the middle, is centering of cultural humility, centering the Hippocratic Oath, the oath that nurses take when they become registered. So what's really great about this cycle too is it's a cycle, that the work, to emphasize that the work is ongoing. The work is every time the cycle you grow a little. I find myself often realizing and coming to terms with something that challenging my own beliefs and going through the cycle and seeing how I can then engage with that. And sometimes, especially as an Asian woman, challenging in beliefs that are just so inherent to my own identity, or even challenging beliefs within my own community. So I constantly find myself going through this cycle in very little and very big ways as well. From this work also, we developed the patient reported experience measure, or began the work to do it. This initial project was specifically with Black birthing individuals, and we've gone on to get funding to expand this work to all birthing peoples of all identities, and I will share that in existing work. From that, we identified these key themes with the goal of developing a patient-reported experience measure for use in quality improvement and identifying education opportunities for providers. This project and this work was in collaboration with Johns Hopkins and was funded by the Robert Wood Johnson Foundation. So where we started basically in 2019, we did interviews with women all across the United States. We published the Cycle to Respectful Care, and then Johns Hopkins developed a maternity resources based on the findings. And the whole goal of this is to really hold systems accountable. So I will then transition to our current respectful maternity care projects. And right now, we transitioned that work to trademarking respectful maternity care. And key to this trademarking work is to secure the Agency for Healthcare Research and Quality's AHRQ's consumer assessment of healthcare providers and systems trademark. So this new phase of that patient development of the patient reported experience measure is to engage and conduct the research in the way that meets the methodological rigor and aligns with the standards of AHRQ to get that HCAHPS certification to then someday be included that for wide use and dissemination. So the first step of this work is for the center, the big lofty goal and exciting goal. And I believe that right now we have all the stakeholders aligned to achieve this goal, is for the Centers of Medicare and Medicaid Services to require this respectful maternity care measurement tool in the United States hospitals. Right now, we are in the process of conducting focus groups nationwide with birthing people who represent all racial and ethnic backgrounds, gender identities, and abilities in the United States to identify survey constructs for this patient-reported experience measure. As a result, in this phase one, our goal is to establish a definition of respectful maternity care based on experiences of all racial and ethnic groups, gender identities, and abilities. So we wanted to also be intentional. We recognize that individuals with disabilities or individuals who don't even have registered disabilities, but just come in with limited ability, even whether that's physical or mental, have very specific needs. And those are the individuals most in need of that respectful maternity care. The goal is to establish a standard for equity-based quality improvement, uplift and center those most impacted by our healthcare disparities, and promote anti-racist maternity care. This work is led by a stakeholder advisory board. There are 10 diverse advisory board members who work together, and they oversee, they revise research materials, they help with recruitment, they've helped with focus groups, and this is just an example of one of our recruitment materials. And then this is a little example of that recruitment process and the 8 different types of focus groups that are underway. We've had to extend that just because we've been experiencing challenges with recruitment. This another one is called our Birth Equity Accountability Through Measurement. What's so exciting about this project is a new relationship and close partnership with NCQA to develop this birth equity measurement. So the goal of this project is to create, test, and implement a quality measurement approach that can align levels of the healthcare systems towards birth equity. So the first phase of this work is to establish a birth equity quality measurement framework that promotes system alignment and can generate measure concepts to develop and test in phase 2. The second one is to gather the process. The goal will be achieved by gathering existing knowledge and gaining consensus on the birth equity measurement framework and prioritize measure concepts for the development and testing. And then the findings is a birth equity measurement framework, principles to guide equity measurement development and measure concepts for piloting. I want to note that going into this work is when we think of bundles, at least in my experience with the measurement world, is when you go in this, like, let's develop a bundle and you look at existing measures and you put those measures in together to create a bundle. When we went into this work, we recognized that birth equity measurement and measures are very limited. And back to where I started with this presentation of imagining ourselves out of this norm, imagining ourselves out of the status quo, we felt that was so critical and so key that our colleagues, that we kind of paved the way and created a vision for what should be rather than accepting and working within the status quo. And that is huge. And this is one of those projects where I was mentioning earlier that we are really struggling with visioning our way out of this system. This is that project where we go dream for us. And it's really hard to dream outside of a system that, as a birth worker or as a healthcare provider, you've been trained into the system, and imagining ourselves out of it. I have to acknowledge and I'm grateful to our funders who allowed us to take the step back so often. And I fully respect that you need these products. And for us as a team, like, we need a framework. It was a little meta in its feeling, but I'm really excited for the vision that we're going to create. And I believe this vision and this framework can be used as a guide for other projects and other measurements and the direction of birth equity in our nation. So the impact is a quality measurement approach that's centering historically marginalized groups and promoting accountability for alignment within our healthcare system. So this project was very involved and just with a high degree of methodological rigor. We started with an environmental scan. We looked at the existing literature, searches, scholar interviews to really find works in progress. Then we conducted stakeholder interviews. So based on those findings, have we missed anything? What do you think of these? Have we, in our analysis of findings and concepts and themes and measures, what do you think? And then we analyze the findings for the use of the framework development. So right now we are very close to that framework development. And then the hope is for phase 2 to disseminate and prepare. That phase 2 is really, really big and exciting because we're going to not only disseminate the framework, but we recognize, like I mentioned before, that measurement when it comes to birth equity is really lacking. And so we in this partnership recognize the opportunity to develop, propose, and implement new measures that fit within that framework. So not only are we creating the goal and the what should be and can be, we're also taking on the task of filling it in and testing it. So that is phase 2, and the preview phase 3 is we'll develop the measure and establish feasibility of building the framework of the bundling framework. So while we are implementing and testing this framework, we are also implementing and testing measures in real time. So we are going to pilot this and test the feasibility with a health network. And again, we're trying to find that right partner because we're going to work at multiple levels of the system, and we have some partners lined up and in mind. For phase 3, we're going to go national and form the national evaluation programs for quality improvement and accountability. The most exciting and recent transition is we were awarded in partnership with Tulane University an NIH grant, a U54, to establish the Southern Center for Maternal Health Equity. This was a dream project. I think it's public, like behind this work is funding for about $17 million in funding to do this project. It's a big deal. It was highly competitive, and I'm just so freaking proud of our team for securing this grant. So this is brand new. We just heard about funding in mid-August. The overall aim of this work is to establish a maternal health research center embedded within our ongoing community partnerships and the existing maternal health research, training, and outreach infrastructure to build and strengthen the network of improved maternal health in the Gulf South, and in collaboration with other maternal health centers of excellence across the country. So we work within the conceptual model of how addressing racism in maternity care. We have a patient, community, provider, system, and policy level component. In that model, you see RP1, RP2, and RP3. So those are Research Project 1, Research Project 2, and Research Project 3. This is a kind of a 5-part project where we had to go in and propose 3 different research projects. Propose and have at the ready a community core and a training team. I also want to just bring us back to where I started, that we are a team of 6, and we just got this amazing, incredible funding. So this is a huge opportunity for us to also grow and build our team in a very strategic way. We are leading Research Project 1, as well as the community core. And my colleagues on the Kiara is on Research Project 2, and she's a co-investigator on that one. And then we are also have involvement in Research Project 3. This is a true collaboration and partnership with Tulane University. It's really exciting, and we're just like, I think, to be real, part of us is just kind of trying to grasp the bigness of this work and what this project means. And I'm also just grateful to our colleagues at Tulane who are able to understand and center our voices and needs, but also uplift us when it's something like an NIH grant hits a small organization like ours. The paperwork and the logistics are so messy that I'm just so grateful that they have like 30 people on their side who are able to like manage and go through all the red tape and the budgets and all of that for us. So it's quite an incredible partnership. Like I mentioned, there's 3 research projects and 4 project primary investigators. That's myself, Dr. Sherry Longo at Ochsner Health, who Ochsner is our key health system partner, Dr. Emily Harville, and Dr. Li Sheng-Shi, and they are leading Research Project 3. So Research Project 1 is to conduct a trial in a large healthcare system of a multifaceted behavior change intervention to reduce biased treatment. So specifically as the primary investigator for Research Project 1, this is quite exciting. This is a project that our team has been trying to push through for years. It's really based on the notion that a number of states, including my home state of California, have implemented policy to mandate implicit bias or anti-racist training for their maternal health care providers. And I absolutely support that legislation, but it's interesting that there's little evidence to demonstrate the efficacy, little evidence in terms of whether any training works, little evidence in what is the curriculum, the modality, what are the pedagogical approaches that show the best impact for improving bias treatment in the healthcare system. So for this study, we're comparing online implicit bias training to an in-person training. The in-person training is where we will pool members of the community or members who are embedded in the community to go into hospitals and train them using a curriculum that is in alignment with other anti-bias, anti-racism training curriculums. And then the other parts of it, in addition to being randomized to in person or online, all hospitals will receive something called, I call it warm handoff to community. As a part of our research, we have learned that community members are just literally sometimes discharged to the streets with little understanding of their social support needs. I believe it's a huge injustice that hospitals say, oh, your blood pressure, your health is fine, go home, not considering that there's so much more to individual health than their vital signs or their physical health in that moment. So connecting hospitals and ensuring that there's a warm handoff into community resources based on the patient's needs. And the other one is implementing and training to equity and all quality improvement. The second project, Research Project 2, is to adapt and evaluate an enhanced remote monitoring package in maternity care deserts and other low health care access areas. This is a test of telemedicine in rural areas and in close partnership with a doula network out in Louisiana. My colleague Kiara Cruz is hugely instrumental and a co-PI on that project. And the last one is a policy analysis, assess the effectiveness of Medicaid legislation intended to improve maternal health. I think this is really exciting too. RH Impact, its roots are in the South in Louisiana, and for us to have this opportunity to go back and make an impact in the Southern states it just feels like we're kind of going back home into our roots. At the core is my colleague, leading this project is my colleague Zainab Jah. She is leading this community core partnership. The overall aim is to incorporate community priorities, vision, and expertise in all areas of the project to return results and benefits of research and training directly to impacted communities. Aim 1 is to establish equitable partnerships between community-based organizations, researchers, and healthcare providers through collaborative research projects and training programs. At RH Impact, we've been doing this all along, and I believe we even just have our own methods and approaches to engagement, and we are excited to bring this knowledge to Louisiana and also in this partnership with Tulane University. Aim 2 is to create a research training laboratory. Aim 3 is to facilitate the translation and dissemination of efficacious prevention, treatment, and policy focused on reducing inequities. And the last one is the training core. So the overall aim is to develop innovative and transdisciplinary educational and training opportunities for early career scholars aimed at developing a research workforce that can reduce maternal morbidity, mortality locally, regionally, and nationally. So the idea is to develop a robust research training, mentoring, and career development program with early career researchers from backgrounds of underrepresented communities and biomedical research workforce to support innovative solutions. And the last aim is to establish, provide, and coordinate expanded training to an interprofessional, interdisciplinary cohort of health researchers. Future directions. We have a lot on our plate. So sometimes when we think about the future, my team goes like, let's just not, we're good, you guys. But we definitely are dreaming. A lot of these projects are wrapping up that phase one. So a lot of our existing projects, you could see we're in that phase one, specifically our patient reported experience measure of that trademarking work. And we're currently looking forward and going into and planning for that phase two as we are engaging in analysis and envisioning what that looks like. Developing respectful maternity care training resources. So building on that cycle to respectful maternity care, shifting power with community-based organizations. Our goal, and especially you can see a theme throughout our work, is how we empower, uplift, and train. A lot of our funding that we get, which is unique to us, is that we really invest and spend a lot of time finding ways to partner with community-based organizations so that we're investing in their work and it's a collaboration. We're not taking from them and learning what they do. We're actually working with them and investing in their best practices that are known to work. And then we're continuing to brokering relationships with stakeholders and quality improvement and accountability measures. So that's that next one is that the BEAM project, the Birth Equity Through Accountability and Measurement project. We are also going into phase two, planning and preparing as we finalize what that framework looks like. And then I just thank you. Like I mentioned, we're a small, mighty team that you can see we have an incredible research portfolio and history of impact of what we've done. I think I spoke really fast, but I welcome questions, and I'm joined here by my colleague, Kiara Cruz, if, you know, but also Kiara, if you're totally good if, if you can't right now.
Susan, that was amazing. Thank you. I cannot believe only 6 of you on the team do all that work, and I'm glad to hear that you're expanding. And Kiara,
yeah, saying it out loud, I'm like, I'm tired.
I don't even know how you have time to dream into the future, but I'm glad you are. Thank you. We have a few questions in the chat that I'll just, unless somebody indicates that they'd like to say their, and Kiara, glad to have you join us on camera. We all know, most of us know the experience of managing and having a sick child, sick young one. So please, if you need to have the baby in hand, please do. The first question is about the publication that Kiara, you linked. And somebody said, I've read it. And will there be a follow-up on next stage results? I understand Washington University in St. Louis is one of the sites.
Oh,
I think that was when we had originally done like the pilot sites. So because we've expanded that work to include all birthing people of racial and identities, that we're going to pause on the piloting of the measure until we can get it validated and then do the CAPS trademark on it. And I don't know, Susan, if you wanted to expand on that, but we took a pause on that so that we can include all birthing people. And so we have to do that whole process again of validating the measure that now includes all birthing people.
yeah. So thank you, Kiara. The original work was specifically with Black birthing individuals across the United States. And we recognized that we wanted the impact. So the initial value with starting that work and focusing on Black birthing communities was that we need to start with and center those most impacted, most marginalized by this work. And then after that phase completed, we recognize that to really have the national impact, the goal to democratize what we learn and to share and to hold our nation accountable. We recognized also, to meet the standards of that trademarking, we actually needed all voices. And we also not lost, but as a part of this conversation, we also recognized and wanted to center the unique needs of individuals with other identities as well. Specifically, a group that is hard to reach that we've just successfully started working with is Native and Indigenous communities in their work. And bringing their voices into what it means to experience disrespectful maternity care and help envisioning with them respectful maternity care. So this work now is pivoting to earn that trademark, and with methodologically what it means is all birthing people.
That's great to hear. Did that answer your question? Good. Okay. Stephanie Telecki of California Healthcare Foundation asked, is your team, Susan, is your team working with the maternity caps effort now underway? And Stephanie, maybe if you're on, you can
You know
clarify.
what team that is? Because we're working with
Stephanie.
we're working with CMS. So we have leadership with CMS on our calls. We're also working a good amount with Yale Core.
Okay, yeah, that's, hi,
this.
Susan.
Hey,
Nice to see you.
It's
Yeah, that's the main thing I wanted to know, is if you're connected with that group, because if not, I wanted to connect you. So I'm glad. So you guys are in the thick of that, and I'm hoping advocating for, I'm sure you're advocating for all these things, because my concern with that effort was that maybe they were out of the loop on some of these other things, all this work that has been done. And so that makes me happy. So yay.
Yeah. And so with Yale Core specifically, we've engaged them in two different ways, specifically with the birth equity, the BEAM project with NCQA to develop the birth equity measurement bundle. And because that we are trying to align with their birth friendly hospitals initiative, and then also engaging them along the way to have those conversations about this patient reported experience measure. And then we're also checking in regularly with the ARC trademark HCAPS team. By regularly, that means like yearly. It's been a long project in the making, specifically because we have to like get funding, do the work, and then we're like, okay, now we have something to share, then get funding and then do the work. So regularly means yearly. I don't want to mislead that we're like on the phone.
Yeah, okay, well, just a sidebar, I don't want to co-opt this call, but I'd love to catch up with you separately. I used to work on that CAPS effort from the RAND team before I came to CHCF, and yeah, I just care passionately about making sure that maternity CAPS has what we need in it, because that's going to become the national standard. And so let's connect soon with you and whoever else from your team.
Thank you so much, Stephanie. Thank you.
And then the last question on the chat thus far is from Danielle Gray. Will any of the selected anti-bias training include respectful care components, or is it completely separate?
It's actually, to be real, it's centered around respectful maternity care. The curriculum that we're using that was developed was based on a lot of the research of respectful maternity care. I want to say specifically was based on the research of a lot of Black scholars and Black activists. And for that reason, it really centers that. It's interesting, to be real transparent, is it's the naming. I honestly don't even know what to call it these days, because a lot of people know implicit bias training. I think anti-racism training is coming through, but I really like the dream of respectful maternity care training, but there's so much, so we'll have to, maybe we need a branding person to help to know what to call it. Yeah.
I like respectful maternity care.
I
well.
do too, but yeah.
Jennifer White asks, in Maryland, given NBEC's or RH Impact's in partnership with John Hopkins School of Public Health, Is your team working with the Maryland Maternal Health Task Force? And if so, how is this work informing their efforts? And Jennifer, you're on. Okay, good.
Kiara, do you know?
We're not. I don't think we're working with that health task force. We were working with John Hopkins, and so because that project is now including all birthing people, it has shifted with who we're working with, but we haven't. Are they doing work that we should be knowing of, that we should get in contact with? If so, we can definitely do our efforts to make sure we reach out to them and see the alignment. I think in this work, there's so many of us doing it, and then sometimes, which is a challenge with public health, is the silos. And so we try our best to, when people let us know about, similar to like the Yale core, we reached out to them, we had a meeting, and then we see where their alignment was, and like maybe right now it's not the area to collaborate, but maybe in the future, different phases of the project could be. So we can definitely reach out to them, or if you have a connection, feel free to include us, and we'll definitely keep an eye on.
Jennifer, feel free to hop on. And if you have if you have anything more to add to that, or you're nodding agreement. Okay.
No, I was nodding in agreement, and I suspect that there may very well be other states that may be in a similar position. And so I would just encourage us to, wherever our circles of influence may be, to make sure that we are connecting the dots, because there's work that the legislature passed efforts back in 2022 and beyond. And it's great to hear all of this work happening in the field. Unfortunately, there are these disconnects that exist. And so I will certainly put you in touch with the right people in there.
Yeah, and I think a challenge too is that sometimes when you're small, or like, state works often gets like missed when you're looking at nationally, right? And so when we're in these rooms, it's nice to know the local organizations that are doing impactful work that we can connect with, because we actually have a community power building team on RH Impact, and that team is focused on seeing who are champions in states, in countries, transnational as well, and thinking about how we can keep them in the loop as we're doing this work, so that we can collaborate, or maybe we can uplift the work that they're doing, even if it means trying to find funding for them. Because I know a lot of organizations locally, that's one of the challenges, the funding to do the work that they've already been doing for a long time.
Any other questions or comments before we let Kiara and Susan go after this amazing presentation?
Yeah, I have a question.
Yeah.
Cecile from the Birth Equity Funders Alliance, and excuse me for not being on camera. And this may be a little bit of a departure, but I have been sort of thinking of and dreaming up ways for us to sort of request data from community-based organizations. That is a respectful way of getting qualitative and quantitative data from them for themselves. I always say that first is for themselves, because if you're running an organization, you need to have that information for yourself, but that can also obviously be shared with the larger field, or funders, to understand what the impact is and how we can better provide funding. So I just wanted to sort of have a space for, if you can provide any ideas on what that might look like, or any resources that could point to having this kind of data collection and sharing that information with grantees.
So you mean like getting it from community-based organizations?
Yes, yeah, like sort of providing technical assistance for them to be able to collect data in a way that is respectful and, not cumbersome and burdensome, but, impactful.
We can tag team, Susan. I think personally, if you can partner with organizations that have that trust across multiple organizations, that would be great. I think one of the challenges is the infrastructure. So like staff capacity, because even us, we're like 6, and I feel like sometimes we're drowning. because our projects are so massive, and like we tend to be quote unquote the community-based organization working with like academic institutions and like healthcare institutions. And so I feel like for us, when we're looking at working with these teams, you know, they're coming with 10, 15 people, and it's like the same 6 of us. Sometimes it's just 3, because we split amongst our teams. So I think if you can find the infrastructure to like give a staff person or a consultant to support that work so that the burden is not on them, or thinking of ways to collect the data that is sustainable, and not just a one-off.
I would agree. And so that is a question that we have been trying to get at through the birth equity, through accountability and measure, our BEAM project, is talking with our community-based organizations, asking them, like, tell me more about your work. Tell me about how you see it as impactful. And because we know that often with CMS that measurement and data is tied to funding. And if we can find a strategic way to get their work measured so that they can still do the things they do. So one participant is like, I don't know, like sometimes I sit and spend 2 hours, or sometimes a patient needs to be seen that I'm smiling and greeting her at the door. So, you know, the 15-minute doctor visit trope just doesn't work. But is it number of contacts? But what if that contact is spending day with a mom and buying them groceries and driving them to their appointments? So we are asking that question of these community-based organizations, like meet them where they're at. The other one is and try to advocate for how we can measure and quantify their work. And then also, the other part of this work and what we try to do is training these community-based organizations to engage in their own research. We part of this our PREM trademark project is training our community partners to do qualitative analysis, and then also identify ways for them to get their own funding. Like, you are, as a part of this team, you now own this data with us. Like, use it, go get funding. You can now, I now grant you qualitative researcher status, and then encourage them to go out and do that work and see and engage with us in this work. So we are perplexed with the same question of how we measure them, but those are the steps we are taking because we see that same questions. Those are the steps we're taking. And just the steps is asking like literally saying, what can we do to measure your work, and how would you want and quantify your efforts to be measured? Engaging those conversations now, as well as teaching them to, maybe if we teach them the methods, they can use those methods and capitalize on that methodology to then find ways to make meaning, their data's made to translate their work into data.
Yeah, it definitely takes some thinking outside of the box to really consider what would be how you measure. So for example, if a woman comes to you, you're a doula, and she says, you know, I'm afraid to have a baby, but by the time she gets to the delivery room, she's no longer afraid. How do you quantify that? How do you, you know what I'm saying? So these are the things that we are grappling with, but I appreciate those suggestions in this conversation that is opening up. So thank you, Susan.
I do too. I appreciate those suggestions as well. I think that's an issue that many funders are grappling with. We have time for one more question, Stephanie.
I just wanted to ask Susan, I wanted to highlight for folks, and I'm going back to the CAPS conversation we had, because I think a lot of people don't know that survey, and I want to call people's attention to it. It stands for the Consumer Assessment of Health Providers and Systems. It's a federal government survey, and the input that the team that Susan described in it, this is likely to become the national standard, because this has been an effort for 20 years that the federal government has funded on a whole bunch of different surveys. There's hospital caps, there's nursing home caps, there's in-center hemodialysis caps, and now they're talking about doing one that focuses on birthing people. This is a big deal. We've been waiting like 15 or 20 years for them to actually include this. And what is really important here is that it actually reflects what we, all of us want to see, like respectful maternity care, attention to equity issues, and all of that. So Susan, I don't know, I know there are different comment periods. If you have any information about that you could provide to Betsy, that Betsy could push out to this group. This is super important, because when CMS requires this, that's what is going to be required of Medi-Cal providers, and any other survey that's out there is not going to get used as much. And so that's why this work that Susan's doing, this is how providers get paid off of their performance, about whether they are doing what we want them to be doing. So anyway, this is a big deal, and I think it's kind of wonky, and people kind of, eyes glaze over when you hear about it, but it's super important if we want provider behavior to change around how they're treating people during the perinatal period. So I just wanted to say that, to like put a finer point on it for Susan. And when we get this link, when they call for comments as the development is happening, we all need to be sending gazillion comments, and we're looking at those documents, even though it's kind of in the weeds, to make sure that that survey reflects where we want the future to be.
Thank you, Stephanie. That is part of what RH Impact, and that Kiara and Susan have defined as holding the system accountable, right? So they're sure going to be accountable to their payers, and the federal government is the single largest payer of maternity care.
And I think that's a really good point, because when you do all these trainings, like, it doesn't really impact provider behavior, but when you start messing with their monies and how they get paid, is when people start feeling like, okay, now we need to start changing some stuff. So I think for us, we've been patient, working on what we need to work on, pushing through the challenges, to just make sure, because we know that this is ultimately going to impact provider behavior, which is going to change birthing people's experiences when they're interacting with the system, because it's a system issue. So we can get people doulas, we can get them transportation to their appointments, we can get them what they need, but ultimately the system is what's causing the harm. And so we have to really lift the burden off of birthing people and really hold these systems accountable.
Right. The system is essentially working the way it's designed to work at the moment, and we need to change it. Susan, Kiara, thank you so much. That was incredibly informative. Appreciate your way of communicating a very large amount of information in a friendly and approachable way for somebody like me, who is a non-researcher, and really in a digestible way. So fantastic. Thank you. Some have asked, will we get this slide deck? Yes, they are generous enough to share it. I will push it out along with that link to the article that you included, Kiara, and the corrected link to, yes. So when you get that to me, I will push that out to everybody. So I'm going to ask, thank you, and give you the rest of your day, and funders can stay on, and we will open it up for a more broad discussion. Thank you again.
Thank you so much.
Bye, Kiara. Glad you could be here.